Hi, this is Dr. Dan with the Medical School Podcast. I'm doing a series of interviews with a lot of experts in the field of medical education, but one is Dr. Ferdinand, author of the Gold Standard MCAT. And as an MD, and myself being an MD, we both get together in these podcasts and discuss what it's like to think like a physician while you're taking the MCAT, the USMLE, or other medical school exams. There's been a scientifically validated paper out there talking about the MCAT myth. This is an idea that rote memorization is all that is required for the MCAT, and that's called the MCAT myth. So this is actually comes from education literature, and it's a mathematical application of Bloom's taxonomy, which debunks the MCAT myth. In other words, the professors in the United States that tend to subscribe to this idea that rote memorization is all that's required for the MCAT are dead wrong. So what does your pre-med advisor think about this? And you'll be able to determine the quality of the pre-medical advising that you're getting. So we will discuss the thinking that is required on the MCAT in this podcast, and we'll also discuss exactly what the AAMC is looking for. It's very similar in nature, and that's the purpose of our podcasts. So if you want to go to medicalmastermindcommunity.com, just click on podcasts and you'll see lots of interviews there with different experts, as well as me taking some scientific peer-reviewed literature and going through those in detail to teach all kinds of different points about medical school, stressors, resiliency, and all these type of factors. So I'm Dr. Dan. Enjoy the podcast.